Fox 61 Morning News begins now.
Good morning. August 1st. It is August already. Can you believe it? This is the Fox 61 Morning News. I'm Dan Amaranti.
Well, still ahead for you here on Good Day Connecticut. Curbing our state's opioid epidemic has been an effort for first responders, lawmakers, and medical professionals. Just ahead, we sit down with Bristol Hospital to talk about the new way it's helping patients with drug addictions.
Well, in recent months, we've talked a lot about opioid overdoses across the state. And at Bristol Hospital, a unique program has begun. The hospital now gives prescriptions for naloxone, which is better known by its brand name, Narcan. Now, to patients who have already overdosed on drugs and survived, but continue to battle the addiction. That's for them. Now, here to talk much more about the program he helped start it, Dr. Andrew Lim is joining me from the emergency department at Bristol Hospital. Doctor, thanks for being with us.
Thanks for having me.
First off, let's talk about the program. What were the major factors that went into this decision to administer the Narcan?
So being an emergency room physician, we really see day in and day out all the lives that are ruined and the lives that are senselessly lost to this addiction. So what we wanted to do, what our physician group, U.S. Acute Care Solutions, wanted to do with Bristol Hospital is create some sort of initiative to help these patients, really come up with some sort of plan to help these patients in a time of need, but also look farther out long term as to how we can help our patient population.
Now, we know it's certainly gotten increasingly worse. Can you put it into more perspective for us exactly how bad it's gotten? How many cases you see on an average?
Absolutely. I mean, locally, we see it day in and day out, but the statistics are pretty staggering. I mean, there are about 1 to 2 deaths per day in the state of Connecticut from overdose. And that's actually more than deaths from injury from car accidents and gun injuries combined in the state.
And it's certainly a significant increase over the last few years.
Absolutely.
How is the program working as far as what happens? Somebody comes in, they've overdosed, they're treated, and then what?
Right. So what we're trying to do is we're trying to educate both our providers, so the doctors and the nurses, that we can actually send people home. We can send patients home with a prescription for the medication. So this is kind of a shift. In the past, this was a medication that we would use acutely, both by ambulance and also in our emergency room to quickly reverse the effects of overdose. So when people stop breathing, and really when they're close to death. And so the medication itself is not new, but the idea of giving a prescription to the patient so that families or concerned loved ones can give that medication in those first few minutes is new. So we're encouraging our doctors and our nurses to provide that prescription to patients who either have a drug addiction problem or who present with overdose so that their loved ones can pretty much save their lives in those first few minutes.
Now, I do have to ask you, because there are a lot of people who say this is not helping the program. Helping the problem, rather. It's aiding the people. It's giving them a fail-safe. But that's not the way you see it.
Exactly. So that was one of our biggest roadblocks, was that new Connecticut laws have actually made it easier and have actually encouraged providers like doctors to give that prescription. And one of the biggest roadblocks is that naturally we think, well, if I provide this medication, patients are going to push the limits. They're going to get higher, they're going to have that safety net, and they're going to participate in more risky behavior. But what we found is, in scientific research has actually proved that having a safety net doesn't promote riskier behavior. And one analogy that I really like is that having seatbelts in your car or having airbags doesn't make you drive faster. It doesn't make you drive more reckless. It actually saves lives.
Now, along with giving the prescriptions for the Narcan, you also give them a lot of information on how to quit, how to stop the problem, right?
Exactly. So we realize that we look at it as sort of a Band-Aid in the acute situation. So when a patient is dying, when they're not breathing, they need this medication. And the second part is when family members give it, it's a temporary medication, so the effects wear off. So it's important that they call 911. But the long-term solution is that we are encouraging detox and rehab. So what we've been doing is our patients who get this prescription are getting a follow-up phone call in 7 days and also in 30 days to make sure, well, A, to check up to see how they're doing, the second thing is to make sure they fill this prescription. And finally, the most important thing is to make sure that they've sought help with rehab and to help them schedule those follow-up appointments to make sure that they get the help they need.
Now, it does sound like the ultimate goal is to get them to detox, to get them to quit, but also, in a way, it's saying, but we don't want you to die.
Exactly.
Right?
Yep.
I mean, that's the goal.
Exactly. I mean, we want to empower the patient's loved ones and the families who see them struggle through this addiction. We want to be able to give them the power to save their life in that acute situation. But also, we want to empower the patient to be able to get help and to really fix the problem.
Yeah, well, certainly it is heartbreaking. We've heard from a lot of families.
Yeah, right.
Doctor, thanks so much for your time. We really appreciate it.
Thank you.
Thank you. Coming up next right here on Good Day Connecticut, calls to deal with the Zika virus.